Good afternoon, everybody. My name is Alicia Clark. I am the Assistant Director within the Division of Long-Term Services and Supports within Medicaid. I'm here with several colleagues from DAIL and our behavioral health. So I've got Marnie, who's going to be presenting with me today, along with Kathy Lerza. And if you'll go to the next slide, Kelly, or can I do it? Okay, thank you. So we wanted to put this meeting together just to talk to all of our providers about our waiver applications, our performance measures that are within those waiver applications. So today we're just going to go over the waiver overview. We're going to talk about the application itself, our approved 1915C waivers. And then within each of our 1915C waivers, there are assurances and performance measures that the state is required to report to CMS. And so we want to go through that because it really takes a partnership between all three sister agencies and our providers to be successful when we're reporting to CMS. Next page. So first, it's important to note that it is a federal and state partnership with each of our waivers. Right now, about 70% of the cost for waivers comes from federal funds, with about 30% coming from state funds. Our 1915C refers to a section of the Social Security Act where it actually authorizes us as a state to provide home and community-based services in an alternative solution to institutional care. Home and community-based services began nationally in 1981 to correct the institutional bias of Medicaid funding. The bias was that individuals could only get support when they were institutionalized. But unfortunately, many years ago, when individuals wanted to live in the community, they could not get funding of long-term services in order to stay in their community. So it was really, they were forced at one point to be institutionalized. And we do have, and we'll provide this after the meeting, but a link to the federal waiver regulations, and then also a link to the Medicaid site regarding where you can find all of our 1915C waivers as well. So today, again, the large portion of what this meeting will entail is talking about the different appendices and the waiver performance measures along with the assurances that are involved. And I won't go through, we're going to get a little bit deeper into these as we go along. So I won't read all 10 of these here that are on the sheet, but you know, when you look at the overall application, it's very daunting, right? Super long. I mean, some of our applications are, 300 pages. But when you start thinking about and want to look at things, what am I looking for? And that can really drive you to the section where you need to focus your attention to. Will you go to our next screen, please? Thank you. So within our application, our document here, we do have a link to each of our 1915C waivers. So we do have 6 of those here in the state of Kentucky. We do have 2 acquired brain injury waivers, 1 acute and 1 long-term care. We have a Michelle P. waiver and supports for community living waiver. Those are for our individuals with intellectual or developmental disabilities. We have a home and community-based waiver for our physically disabled or aged individuals. And our model waiver 2, which is for individuals who are ventilator dependent or on an active weaning program. And then we do provide you with a link to all of our 1915C waivers as well. We do have a lot of good information out there on our website. So I do encourage you that if you have not been out there on our website, I can get Kelly to put in the link, because we have a page for each of the waivers and our other long-term services and supports that we do. But we have really important information that you can go to look for providers. There's participant resources. There's so much valuable information, and we want each and every person to share with individuals out in the community. So in each of the appendices of the waiver, the state, we have to describe how we are going to meet the requirements of each of the HCBS waiver programs. And like I said earlier, there are 10 appendices, and 6 of them include assurances. So we'll start off with Appendix A. That's going to be the administrative authority. So me, as the Medicaid agency, we retain the ultimate administrative authority and the oversight of all of our waiver programs. So we have to really look and measure the performances and functions of our other state, whether it be local, regional, non-state agencies and contracted entities. So we receive reports that, so if we have, with our sister agencies, there are contracts that we have, so we're monitoring them. We might have contracts, an administrative contract to do certain functions of a waiver piece, and we have to monitor those. So that is one assurance that we have to do through the Appendix A. And the Appendix B, which is the level of care portion of the waiver application, we have to demonstrate that we have processes and instruments in place in order to evaluate or reevaluate a participant's waiver level of care each year. And so, some of our waivers, they have to meet nursing facility level of care. There are other waivers that have to meet the intermediate care facility level of care. And the evaluation for the level of care, it's provided to all applicants whom there's a reasonable indication that services may be needed in the future. And then the instruments that we say we're going to use within our waiver applications, we have to then look to make sure that they are also applied appropriately and according to what we say in the waiver application. So we, again, are always, it's based off of a lot of data that we do. And we go to the next page. Thank you. Appendix C is going to be about our qualified providers. So as the state, we have to ensure that we have an adequate system, ensuring that all the waiver services that are provided to our participants are provided by qualified providers. So one of the things that we have to look at is to ensure that we have processes in place where, as a provider, you initially and continually, so every year, meet the required either licensure and or certification standards. Some of our providers have license and certifications. Some are just certified. But before you as a provider can provide any services, we have to show that you have everything in place. We have to monitor to ensure that no non-licensed or non-certified providers that they assure to the adherence to the waiver requirements as well. In the state, we implement it, we have to look to make sure that the policies and procedures that we have for verifying the provider training is also conducted in accordance with the state requirements in the approved waiver. And I feel like I know that I'm giving you a lot of information, and right now we're talking high level here. We're going to get into deeper. I don't expect everybody on this call to understand every single thing and to grasp it right off. I think the main thing is, from the state's perspective, we want to let you all know what all is involved, and to ensure, because what you provide us and the things that you all do, and we're looking at timeliness of certain things from you as a provider, but it really takes a team effort to make sure that all of this goes smoothly, that we can report to CMS. If we don't meet certain standards, then there is kind of like a correct, I don't want to call it a corrective action plan, but we have to show them what we've done with our providers in order to get our percentage rates up. So it is a lot of information. I don't want to overwhelm you, but I think it's important, that you all understand how all of this works together to ensure that we can keep getting that federal funding. And then the next one that we're on here is Appendix D, and this has to do with the service plan. So we have to demonstrate that we have designed and implemented an effective system for reviewing the adequacy of all of our service plans for the waiver participants. So each service plan must address all the participants and assess needs, including, health and those safety risk factors, their personal goals, and either through their waiver services or other means through the community, even other state plan services. Service plans have to be updated and revised at least annually, or if there are changes in the assessed needs. So say somebody goes into the hospital, they need a plan update. That is information that we have to pull. So it's very, very important that, when there are changes, that they are documented appropriately and the changes are made to their person-centered service plan. We have to ensure that services are delivered in accordance with the service plan, including, the type, the scope, amount, duration, and frequency. So we do a lot of quality checks on what you're requesting as a service and then what's actually being provided. And then another big thing with the service plan is it is so important that participants are afforded choice between, their service providers and what services they are receiving. Next page, please. Appendix G, health and welfare. This is the assurance that where we have to demonstrate that we have designed and implemented a good, effective system that's assuring our waiver participants' health and welfare. So on an ongoing basis, we have to identify, address, and seek to prevent any instance of abuse, neglect, exploitation, and unexplained death. This is where a lot of our incidents come in. We require lots of follow-ups, and what can we do to prevent things in the future? The state also has to, demonstrate that incident management system that I just spoke about is, not only in place, but effectively resolves those incidents and prevents, future similar incidents from the extent possible. I understand there are going to be incidents. We want you to report those incidents. It's very important to do that. But when there is a place where we can be better to prevent and be proactive, then, we need to take those opportunities for enhancement there. And then we have state policies and procedures for use or prohibition on restrictive intervention. So that is including the restraints and seclusion. We need to ensure that all those policies are followed. And then the state establishes overall healthcare standards and monitors those standards based on the responsibility of the service provider as stated. Again, everything does go back to the approved waiver, what CMS has approved for us. Next page. And then Appendix I, that is our financial accountability. We as the state, we have to demonstrate that we have designed and implemented an adequate system to ensure the financial accountability of our waiver programs. So we have to provide evidence that claims are coded and paid for in accordance with the reimbursement methodology that is specified in each of the approved waiver and for only the services rendered. And then we provide evidence to show that our rates remain consistent within that approved rate methodology through our 5-year cycle. So if you're not familiar, our waivers are approved for 5 years at a time. And then at the 3-year mark is when we have to present to them a huge, I'm going to call it a packet for better words, of all of our quality and what we have been monitoring and all of that. And then, they go through it with a fine-tooth comb, provide us with information back, and really work with us on how we are going to work with our providers on how to get better. And then our next one, oh, I think we went the wrong way. So we do have a CMS webinar regarding HTBS services. So we've got a link there that's important that we will provide you all. And then let's go to the next page. And I am going to, so we're kind of switching from waiver assurances as overall topics to then the performance measures within those assurances. And I'm going to turn it over to Kathy Larsa for this portion.
Actually, Alicia, I am going to steal it from Kathy Larsa, and I'm going to take over.
I am sorry.
That's okay.
Marnie is up next.
Yeah. So hi, my name's Marnie Mountjoy. I am with the Department for Aging and Independent Living, and we oversee the administration of the home and community-based waiver and the participant-directed options in the other waivers. So thank you for being here with us this afternoon. Alicia just went through all the different assurances, and so now I want to talk about the performance measures. So for each assurance, we have to provide at least one performance measure showing how we're going to meet that assurance that has been set for us. We have to make sure that those performance measures are in compliance with the HCB setting requirements and then any other regulatory requirements that are part of the waivers. For our performance measures, there's an 86% threshold. So, for me, college, D for diploma, but in waiver world, it's 86% compliance. So that's the threshold that we as a state must meet. And if we do not meet that threshold, we have to provide CMS with a plan for how we're going to improve and achieve that performance measure. And while it's up to DAIL, BDID, DMS to really gather and report that information back to CMS, a lot of the actual responsibilities are put upon you as the provider. Next slide, please. So starting with Appendix A, so there's, like Alicia said, it's the assurance that Medicaid retains the ultimate administrative authority. So the performance measure that we have set for this is that providers have to have a current approved provider agreement. So 86% of our providers have to have that approved agreement, and that's where we rely upon you to keep your information current in Partner Portal. Next slide. For Assurance B, that's the evaluation of the level of care is determined for all applicants. The performance measure that we have is level of care reviews must be conducted within 60 days that capacity is reserved. So within 60 days that they've been determined eligible and they've been given a slot, a level of care needs to be completed. So it's really important for you all to do what you can to make sure that all those LOCs have been submitted and the determination has taken place so that we can meet that 86% threshold. Next slide. Along with Appendix B is the assurance that the instruments described in the approved waiver are applied appropriately. So our performance measure that's set for that is waiver participants whose initial or subsequent level of care was appropriately determined using the assessment and supporting documentations. And the part where we need your help is making sure everything is submitted and that all the current forms are submitted, that you're using the current forms, and that all documentation is available in MWMA. Because there's a lot of reports that could be pulled from MWMA to help us report these performance measures. So making sure the information is in there is key. Next slide. So for Appendix C, that's around participant services. So this is where we provide the assurance that we verify that providers initially and continually meet the certification and licensing requirements. This is where we have set the performance measures that new providers must meet that initial requirement and adhere to the standards set forth through certification requirements set by OIG, through licensing requirements set forth by OIG, through certification requirements set by DAIL and by BDID, that enrolled providers continue to meet those requirements and adhere to all the standards. And it's really your responsibility to make sure you know what those requirements are and that you thoroughly train all new staff on what those requirements are to render waiver services. Next slide. We also have the assurance that the state monitors non-licensed and non-certified providers. So this is the PDS component. So the performance measure is that PDS employees meet the initial personnel requirements prior to providing services, and that existing employees continue to meet those requirements. So these are the things that, and I apologize, I did not get my slide updated in a timely fashion. So the provider responsibility would be the background checks, the drug screens, the TB test. All of those things need to be completed and in the file, or I'm sorry, completed and available for review. And they need to be completed prior to the service delivery to the waiver participant. Next slide. And the assurance that the state implements policies and procedures for verifying that provider training is conducted. So the performance measures that we've set for that are staff have successfully completed the mandatory training requirements. PDS staff have completed the mandatory retraining requirements, and the responsibility that we have for you all is making sure that you track the trainings that have been completed, such as having a log sheet, you have signatures, you have dates, attendant care trainings have been scored and signed off on. So making sure that the training is available, so when staff do come or do have you submit information for monitoring and certification review, that information is available for us to find and report back on. And to that, I think this is where it's going to be the Kathy Lerza show.
Yes, it's my turn. I'm Kathy Lerza. I'm the Assistant Director of the Division of Developmental and Intellectual Disabilities, and I'll continue with going through the performance measures. So the Appendix D, participant-centered planning and service delivery. We have to assure that service plans address all of the person's assessed needs, including health and safety risk factors and their goals, and that those need to be either through the provision of waiver services or through other means. So the plan is to include narrative about anything that the person needs that is going to be delivered through both waiver services and non-waiver services. One of the measures is that service plans have risk assessments, and that the documented risk mitigation is included. And so it's important to make sure that risk has been assessed and that risk information is provided. The accompanying data and documents section of the person's record in MWMA is intended as a place to capture information regarding risk and risk mitigation. And then the next one, the assurance regarding service plans with goals and objectives that address the assessed needs and the person's individual goals. So it's really important to make sure each plan is truly person-centered by utilizing the assessments, other documentation, conversations, and that they clearly address the person's needs and their own personal goals. In addition to the risk mitigation section of the accompanying data and documentation, the section, and it's titled transition plan, but that's not really what it's meant to be. And as a matter of fact, the document, the PDF that it creates when you use that section is, it says individual narrative, but it walks through a number of things to be very purposeful, person-centered planning. So it asks, what are great things about the person? What do people like about them? What are, the real good things about them? What is important to them? What is important for them? What characteristics does anyone that's supporting them need to have in order to support them well? What do people need to know about the person in order to support them? What things still need to be figured out? What's going well? What needs improvement? And then finally, support needs. So all of those are sections of that. So it really walks you through doing person-centered planning. So I don't believe it's required in all of the waivers to use it, but it does help walk through that person-centered planning. I recommend it for all of the waivers. And then we'll look at Appendix G, which is participant safeguards, is next. Oh, actually, I think I skipped some slides. I'm so sorry. I apologize.
Look like we're in the right place there.
Okay, so, yeah, I had skipped to where I had made notes, so I do apologize to everyone. So there are performance measures regarding the service plan being updated and submitted within a year of the last one, and that modification is done anytime there have been identified changes. Change in needs. So those are both very important. Make sure to update plans timely, both as needs change and within a year of the last annual plan. And so it's really helpful in doing a modification to really explain what the change was, and then to be sure to do the updated, new plan within a year of the last one. And then the performance measure regarding participant records indicating that individual has been given choice. That's very important to capture also. So be sure to provide the choice and then do the attestation of that choice. And now I'm to the part where I had some notes. So this performance measure, participants or their families or legal guardians receive information on how to identify and report abuse, neglect, exploitation, and unexpected death. It's important to not only provide the thorough details, but it's important to have some way of capturing that has been done, and having a log, with signatures from the people and their families when that has occurred, so that there's a good way of proving that it has happened. And then 2 performance measures here, report of abuse, neglect, exploitation are submitted in the time frame, and that they are reviewed and investigated. And a link is here to the instructional guide. But I also wanted to add that it's important to not only provide thorough details on the initial submission of the incident, but also do a thorough investigation, including determination of root cause and what to do to prevent subsequent incidents. Completing the risk mitigation and investigation report, RMIR, thoroughly is really important to provide information about what has been done. In follow-up conversations with providers, we sometimes find that they've done what needed to be done, but it wasn't captured well in the RMIR. So it's just really important to put that information in there. Record actions taken. If an action taken doesn't seem to totally fit within one of the questions in there, it is open text, so you can still, write it in wherever you think it fits best. So it's just very important to do those very thoroughly. And then we have to also show that provider follow-up, the CAPs have been completed correctly and on time. So it's important to be thorough with those and timely. And then I've talked really about the instructional guide and the RMIR, so it's pretty much the same comments here. Be sure to report things that need to be reported, and then do a good job with the follow-up. And then it's also, employees need to receive the training on abuse, neglect, exploitation, and preventable deaths. And that also needs to be tracked, compiled and tracked so that it can be proven that that has been done. And then there's a performance measure that critical incidents with that root cause has been identified and that intervention has been implemented. So again, why it's so important to do a thorough job reporting and recording what has happened on the RMIR. And I think it probably sounds like I'm harping, but it's because I can't say every provider, but it is an area that it really needs a more thorough, thought out, written out what has happened. And then the use of restrictive interventions followed policies and procedures. Each waiver states whether or not the restrictive interventions are allowed. And so it's important that those be followed. And there is information within the incident reporting regarding those also. And then there is a measure that participants have received information and support to access Medicaid state plan services, that it's been identified in their person-centered plan, so that it's necessary to be doing that so that we can show that that is happening. And then financial accountability, we have to show that claims have been coded and paid in accordance with the reimbursement methodology, and that they have only been paid for services rendered. So it's part for the provider responsibility with that is making sure services are prior authorized, and then maintaining proper documentation of the services provided, and only submitting claims for things that have been provided. It's really important for to make sure that the staff who actually do the billing know if someone was out of services, know, truly what was actually provided. It's more common than should be that we're told, oh, sorry, our billing person just didn't realize they weren't there. But so they need to know that. And that, I think I'm ready to turn it back over to Alicia.
Thank you, Kathy. Thank you, Marnie. I know that this might not be the most glamorous, interesting subjects of all that a lot of people that we like to talk about, but this is really, really super important that you all understand and that we all work together. But just we put together a few takeaways here that the assurances, for one, those are determined by CMS. So we have to have a performance measure for all those assurances that they require. We do have a little bit of leeway with the performance measures. So we get to define those to a certain extent. I kind of laugh because even though we say that we want to do it a certain way and we put in this nice language that we think is great, sometimes CMS does come back and tell us, no, we don't like what you have and you have to redo it. So that's always interesting. But we are always, again, we take suggestions on our waivers. This is part of the waivers. So if you have suggestions on performance measures, we are always welcome to those. We want to hear from you, so you can definitely submit those to the operating agency of the waivers. And if you have suggestions on how we can capture some of these performance measures, definitely let us know on those. We are welcome to any suggestions that you all have. And ultimately, you all do have a huge role in this and the responsibility to ensure that we are in compliance with our performance measures. Like Marnie talked about earlier, that 86 is the magic number. They don't like to see us around that number, but anything 86 and below, we are having to meet with them, and their audits are a little intense sometimes, right? They're not fun. So we have to tell them how we are going to improve on our statistics. And then, again, we need you all as a great partner, and we need CMS because the 70% of that funding does come from the federal government. And in order for us to continue providing waivers to Kentuckians, it is contingent upon getting that funding, and part of that is ensuring that our performance measures are good, that they're approved by CMS, that we're capturing them, we're reporting them appropriately. And ultimately we're doing this for the Kentuckians who need our help. But I'll go to the next slide, please. And on our next slide, we just have information here. Obviously, the ABI waivers in Model 2, we are the state agency, the operating agency. As DMS, we are the single state agency that oversees all the waivers, right? So we have to answer to CMS, even though that we have our awesome operating agencies here with us. ABI and Model 2 is by the Department for Medicaid. So there's our contact information. HCB waiver and participant directed option, those service, that delivery method for all the waivers is operated by the Department for Aging and Independent Living. And then, of course, our Michelle P. and SCL waivers is operated by our Department for Behavioral Health, Developmental, and Intellectual Disabilities. So at any point, we're all here to help. We wanted to, again, meet with you all today to show you, because I know when you all look at those waivers, probably a lot of people kind of look at the services, but it's important to know and understand each piece of that waiver application as it is approved by CMS, and how we can partnership to just ensure that we are continuing to meet those quality performance measures to their liking. So again, I appreciate you all coming and listening to this today. And Kathy or Marnie, do you have any closing remarks? I do know that there were some questions about, will this be available? Yes, we are going to make the slides available to you all. We'll put that out there. Anytime you all want to refer back to it, please do. If you have questions, please ask those questions. And if there's any way that we can help you all and how to assist your agency in meeting each of these performance measures, let us know. Marnie or Kathy, any closing words from you all?
I was
Sorry.
going to thank everybody for their attention and time this afternoon, and feel free to reach out with any questions. If you have any comments or concerns, please let me know. And yeah, Kathy, I pass it back to you.
Yeah, I did what Marnie says.
All right, thank you all, and everybody have a wonderful day.